My task here is to talk about anosmia and what happens when people lose their sense of smell. And I would like to start out first, maybe Tim has talked about this a little bit, I don't know, about the significance of the sense of smell in humans, just to give a few examples. Then talk about the ways one can assess olfactory loss, and talk about the epidemiology of olfactory loss, and finally I touch upon treatment of olfactory loss. So first of all, one has to ask the question, as a researcher in sense of smell, we have to ask that ourselves all the time, how good is the human sense of smell? I mean, we're all biased here. I think we all think the sense of smell is really important, you know, it's odor. But in fact, we are, as humans, we are animals who rely on vision and hearing. These are the most important senses. If we don't see, we run into the door, you know, we can't stop, we have to stop working. If we can't hear, we have a real problem. If we can't smell, that's different. So people get along very well. There are people with congenital olfactory loss, with inborn olfactory loss, and they make a splendid life. They find nice partners, they have children, they are successful in their job. So it's actually doesn't seem to be much of a problem living without a sense of smell. So it's quite a little bit a controversion that one can build here. The question about how good the human sense of smell is, the dog, and the dog clearly outperforms the human. This is when you just look at the outside of the noses. But let me show you one example. There's research showing, comparative research, looking at odor thresholds between different species. And what you have here is you have like odor thresholds for various species, for the mouse, the rabbit, the vampire bat, the fruit bat, the dog, the rat, humans, and macaques and whatnot. So when you look at these thresholds, you can see that, at least for these odors, human outperform the rat. This is somewhat unexpected. And also examples that humans can outperform the dog. Of course, overall the dog wins, but for some odors, humans outperform the dog. I think that if you talk in football terms, I think it's like 7-2 right now. So but it's not bad. Human sense of smell is not, we're not completely lost here against other animals. Another example that I'd like to show you is scent tracking. What is here is you maybe recognize this pheasant here, the bird in front of the picture, and as the pheasant is running through the meadow, it leaves a scent track, and the dog, which you may recognize here, the dog is following the scent track and is crisscrossing the scent track, and finally the dog would find the bird and catch the bird. The question is, can humans do that also? And the answer is yes. If you put a chocolate trace into a lawn, then put female students on it, they would easily track us to the chocolate. So we're not that bad. That's another thing, another example that I'd like to show you. We also can scent track. I talk about olfactory loss. What is actually what makes olfaction significant in our lives? There are just 2 points that I would like to pick up here. One is sex. It's important. So olfaction plays a role in the choice of our partners. It's not totally concluded in humans, but it may play a big role here. And of course, another thing is eating and drinking. These are the two major domains where odors play a role. When we have lost our sense of smell, we also have lost large pieces of our sense of taste. You may have recognized that yourself when you had a flu, when your nasal cavity was blocked, then the food tastes bland. You just perceive sweet, sour, salty, bitter, that's all what's left. Or the flavor, that's gone. Because the flavor that you perceive during eating and drinking, it's coming actually from the mouth into the nose, and it's perceived inside the nasal cavity, and this is what adds the spice to our lives. If you don't have that, if your nasal cavity is blocked, if you have lost the sense of smell, you just can taste sweet, sour, salty, bitter, umami from your spiciness from your food. The rest is all gone. You can eat cardboard. You would not make a difference between pizza and cardboard. You know, well, pizza may be salty, but not much difference there. And you can imagine the consequences are quite large. If you can't taste foods, then you're out of most social occasions. I mean, if I think about my life, and sometimes we have friends over on a weekend, and Sunday morning we would get up and we would have breakfast, and then we would eat for 2 hours breakfast, and then we would talk a little bit for 1 hour, have a coffee and a cake, and would walk around for 1 hour, come back and start to prepare for dinner, and then have dinner for 4 hours, and have cigars and red wine. So overall, if you don't smell, you're out of this loop, and you can't really comment on that. Life becomes miserable. And this is what patients tell us. The patients, actually 2/3 of the patients who come to our department with loss of sense of smell, they are depressed. They show signs of depression. This is what it comes to. So life without a sense of smell, you can survive, of course, but life does not become nicer when you lost your sense of smell. Actually, another thing is when you look at the chemical senses. The chemical senses are highly interactive. I touched upon one thing already here is when it comes to eating. Eating, you have a high interaction between taste, between sweet, sour, salty, bitterness, umami, and the sense of smell. And there are other interactions that are important. That also, you have a trigeminal nerve in the nasal cavity in your mouth that mediates spiciness, irritation, or coolness in your nose, or tickling, and this is what's mediated by the trigeminal nerve. And all these senses, they interact. There's also interactions from other senses like seeing and hearing, but they all come together and they form this gestalt of a food that you eat finally. When you lose your sense of smell, you lose much of this interaction between those senses. Actually, within this network of the different senses, how they interact, smell, you lose a sense of smell, and then you lose also amplification for other senses. All of a sudden, when you lose a sense of smell, you also have a decreased taste sensitivity and a decreased trigeminal sensitivity. It all goes down, and it's probably due to an interaction in your brain so that all those different senses all play together and interact each other variously. So it's a tragedy that not only relates to sense of smell, but it also affects other chemical senses because they are also interactive. What are the major determinants of affective sensitivity? I'll tell you that just because, probably you know this, but it also is important for the patients that approach us and for the complaints that we hear. One major factor here is sex. Of course, women smell, what would you say? Better than men. Of course, the reason for that is unknown, and we think it has to do with social competence because odors are social signals, and our social signals in terms of body odors and food odors, and this is why women have higher social competence, they're more interested in odors, and this is why they outperform men. So that's our current theory. We have like 2 or 3 data to back that up. So that's a factor here. Also, women are more affected when they lose their sense of smell. When we, for instance, in our clinic, we have men and women, I think almost equal numbers that approach us, but the complaints are very different. That's one, if you look at it broadly. Women come to us and many of them, they would break in tears and would complain about the loss of sense of smell. They would deeply complain that they can't smell their partners anymore, that they can't smell their children anymore. So for them it looks like a dimension of the life is lost. Men come to our clinic and they say, "Doctor, I can't smell the red wine anymore. Can't you do anything about it?" So men are food related and they are red wine related. This is what occurs in our clinic. And some of them, the men come and say, "Actually, I don't need to be here. My wife just sent me here because I don't appreciate the food anymore." So these are complaints, difference between men and women when it comes to loss of the sense of smell. Of course, there's for many men it's also important, the sense of smell, but it's the minority. For women, it seems to be a very different matter when they lose the sense of smell. One patient actually expressed it quite nicely. She said to me, when she wakes up during the night is just black. There's nothing. And before that, she always had a smell. She smelled the partner and smelled the room and whatnot. And now she wakes up at night and there's blackness. So I think it describes nicely what this can mean when you lose your sense of smell. Other factors are age. Of course, as we get older, we lose our sense of smell, and this is dramatic. If you think about people older than 50, then 23% of them have a decreased olfactory sensitivity. When you take people who are older than 70, then 1/3 of them has lost the sense of smell, meaning they can't appreciate any perfumes, can't appreciate any foods, at least in theory. So they're lost for a consuming society, if you will. You can feed them again with cardboard. It doesn't really matter. So the graph is here, and this is the sad truth. If you look at people, this is the age groups, they are listed in decades, plotted against olfactory function. And if you see from an age of 70 on, at least 1/3 of us, as we are in this room, will lose dramatically our olfactory abilities. So that's a very sad story. And it's also very sad there's practically no research done in that area. Imagine that people would lose their vision from an age of 70 on to that degree. You know, that would be a catastrophe for society. Just because it's a sense of smell, actually the society can live with that. So we can afford not to look at these elderly people. It's also, if you look at this quote again, this ratio again, probably you sometimes are in homes for the elderly, and if I'm there, I always have the impression that the meals are the highlights of the day. And if you can't perceive those meals, then you miss those highlights. So it's very, very sad. Of course, then one can make the joke then about older people. If one can't smell anymore, you also save money because you can buy the cheaper one. You know, it doesn't really matter. But that's not how it should be. The intranasal volume, of course, relates to olfactory sensitivity, and there are several areas that are outlined here. There's one area up here in the nasal cavity that relates to olfactory function, and also one at the entrance to the nasal cavity that relates to olfactory function. But actually what I would like to show you is the nasal cavity is very narrow. So it's actually when it comes to the olfactory cleft, where the olfactory receptors are, it's about that wide. So you can easily imagine if your nose becomes congested a little bit, the olfactory cleft is closed, and no odors are getting up there again. So the nasal cavity is a very narrow thing. It's also a highly important thing. Of course, I'm biased here because I'm from the ENT department. But imagine if your nose is blocked, it's not only affecting your sense of smell, it also is affecting your speech. It's affecting the way you swallow. It has many, many effects. If your nose doesn't work, it's not a nice thing. You don't think about your nasal cavities, but if the nose does not work, life becomes very miserable. So trust me. So how to test olfactory function? Just very briefly. I would not go don't spend too much time here. One question one can ask, why do we have to test olfactory function? Can't we just ask our patients how the sense of smell is? And the answer is plotted here. What you see there is the rated olfactory function plotted against the measured olfactory function. And what you can see there, it's a random distribution. So people tell us all kind of answers. Even if we have people who have lost the sense, who have no sense of smell, we ask them about their sense of smell, they tell us perfectly fine. We test them, it's gone, it's nothing there. On the other hand, people would come to our clinic, they swear that they have lost their sense of smell totally. We do measurements in them, find them, they're in the normal range. So both can happen. People describe the sense of smell very badly. What they tell you here, and what they tell you in this graph is about the nasal airflow. This is where people are good to describe. This is what people can describe very well. But they would not describe the sense of smell. How can we test that? We use, for instance, the sniffing sticks. This is a very simple system where we put odors into these pens and apply these pens to our patients. We use olfactometry, record olfactory evoked potentials. These are EEG-derived parameters. For this we use olfactometers like that. They are room filling, and then the outcome is actually a big discrepancy between the apparatus and what comes out of it. So this is how the odors are applied to the nasal cavity. And this is then what we can record, so we can get these evoked potentials. And from these evoked potentials, actually, we can backtrack the source of these evoked potentials and measure where the response comes from. We also can use functional imaging to look at that. I'm certainly familiar with that. It's magnetic resonance imaging-based technique. We put our people into a scanner, and then what we can see is we see these brain areas that are being activated, and that allows us to see where odors are being processed and also in disease, what's happening there.